Good morning and welcome to UroNurse News. Be sure to like and subscribe. I'm Vic Senese, and today we're discussing a potential game changer in the management of recurrent UTIs. In a recent Phase 2 study published in Nature Microbiology has found that Anakinra, a medication that targets inflammation, appears non-inferior to the antibiotic Nitrofurantoin for treating acute episodes of recurrent uncomplicated cystitis. Non-inferior. Let's break down the study. This was a prospective, randomized, open-label, single-center trial conducted in 30 adult female patients who had a history of recurrent cystitis. Patients were randomly assigned in a 2-to-1 ratio, 20 patients receiving Anakinra via subcutaneous injection, 100 milligrams once daily for 5 days, and 10 patients receiving Nitrofurantoin orally, 100 milligrams twice daily for 5 days. Now, the primary endpoint was the change in acute cystitis symptom score after 5 days. Secondary endpoints included bacteriuria and leukocyturia at follow-up visits, recurrence rates over 6 months, safety assessments, exploratory analysis of uroproteomics, gene expression, and DNA sequencing. By day 5, symptom scores had significantly improved in both groups. Specifically, 19 of 20 in the Anakinra group reported reduction below baseline symptom scores. 8 of 10 in the Nitrofurantoin group did the same. So, on day 5, scores remained low. At day 15, day 30, and even at 6 months, with p-values less than 0.001. In terms of symptom relief, 60% of this Anakinra group reported alleviation of all or almost all symptoms. 70% of Nitrofurantoin group reported similar improvement. Recurrence rates after 6 months were lower than patients' baseline history for both treatment groups, and quality of life scores improved across the board. So, as far as adverse events and safety, adverse events occurred in 35% of the Anakinra group and 10% of the Nitrofurantoin group. All adverse events were mild and no participants discontinued treatment. Now here's where it gets really interesting. Gene expression analysis revealed that Anakinra affected innate immunity pathways not seen with Nitrofurantoin. Specifically, Anakinra appeared to inhibit cytokine storm signaling, regulate innate immune responses. And I seem to recall that cytokine storm around the COVID times. Microbiological analysis also showed a decline in bacterial burden with Anakinra. After 6 months, 45% of the Anakinra-treated patients had less than 10 to the third colony-forming units per milliliter. Only 30% of the Nitrofurantoin-treated patients reached this outcome. In conclusion, Anakinra demonstrated non-inferiority to Nitrofurantoin across symptom improvement, quality of life, and recurrence endpoints. This could represent a novel inflammation-targeted approach for women struggling with recurrent urinary tract infections, potentially reducing reliance on repeated antibiotics. Hey, this Saturday, talk about UTIs on UroPatient, struggling with bladder infections and recurrent UTIs. I'm going to talk about it. Join me as I break down expert tips to prevent, manage, and stop urinary tract infections for good. Learn practical strategy, lifestyle tips, and when to seek professional care so you can take control of your bladder health. Tomorrow on UroNurse News, in an era where MRI and PSMA PET scans are revolutionizing prostate cancer detection, is the digital rectal exam still relevant? Join me as I explore the latest research, clinical insights, and practical guidance for both patients and healthcare professionals. Don't miss this episode if you want to understand how traditional exams and advanced imaging work together to catch prostate cancer early.
UroNurse News every Monday through Friday at 9 a.m. Central Time.